Hey everybody, this is Dr. Cohn. I'm sitting outside in a little park area and I just wanted to do an informal talk on a topic that is close to me, and that is about thyroid problems in general and about the particular subject of when people think that they're taking medicine for their thyroid. I had a conversation with a patient, and probably a couple of conversations last month, explaining to people that when their medical doctor is giving them some hormone replacement therapy, that is really not doing anything for their thyroid. What is happening is, in essence, your thyroid is right here in your neck, and it is like a little factory. It produces hormones, and it needs certain supplies, raw materials to work. It needs certain vitamins and minerals, some amino acids, and then it produces its hormones. So if there is something amiss with the thyroid gland, it is usually either a deficiency of some of the things that it needs, iodine, trace minerals, sometimes an amino acid, or there is something that is bothering the thyroid. It may have all the things it needs, but something is attacking it, causing inflammation, autoimmune type response. Sometimes there's a food allergy that's triggering some dysfunction in the thyroid gland. Sometimes there's a virus or some type of little low-grade infection that is attacking the thyroid gland and causing some troubles. And so the thyroid is not performing correctly, and then you have a lot of symptoms. It's hundreds of symptoms related to thyroid dysfunction. I won't get into that right now. But people say, oh, I'm taking medicine for my thyroid. No, what you're doing is you're taking the product that your thyroid needs to produce. So if your thyroid's a little factory and it makes cars, for example, the standard care is we're not going to do anything to fix the factory. We're just going to let the factory sit there not producing anything and just kind of having some troubles. We'll let that continue, but we're going to just import some cars so that the product is there. So that's in essence what's going on. You take a hormone by pill, usually, that gives you some thyroid hormone, but it doesn't do anything for the thyroid gland. So your thyroid gland is still annoyed or starving. It still exists. It's still an angry customer. It's still something that's having some troubles, but you're taking the product. So that can help a lot of people. About 50% of people, I think, take hormone replacement therapy, and they say, oh, I just feel a ton better. That cleared up everything. The other half seem to take hormone replacement therapy, and they say, it's not really doing what I hoped. The medical doctor is stumped because my thyroid blood levels of thyroid hormones is where it's supposed to be, but I still don't feel too good. So in that case, usually what's happened is the thyroid is still so frustrated and angry that something is still going on, that problem with the thyroid is overriding the fact that there are some thyroid hormones in the blood. And usually I find people, if we investigate what's going on with the thyroid and get down to what it needs, either get rid of the irritant or supply it with some of the nutrition that's lacking, people start to say, oh, I'm starting to feel better. My headaches are going away finally. My energy's coming up. I'm losing weight. I'm not constipated. I can get pregnant now if I'm wanting to. Just my hair is finally starting to thicken up and stop falling out. Just feeling better. I'm not depressed. I'm sleeping. My insomnia is going away. So just wanted to kind of get that through people's minds, that hormone replacement therapy is doing nothing for the gland that produces the hormone. It is, in fact, I think, doing a little bit of a disservice. It's like we're not even going to investigate why the thyroid is angry. We're just going to bypass it. Let it stay there and stay angry. I am much more interested in trying to find out what the thyroid needs to stop being angry and start producing its hormones again. So just wanted to kind of do that as a quick little talk, and hope that makes sense. Generally, as the thyroid starts to get stronger and produce hormones again, people notice that they need less and less and less of their hormone replacement therapy. Why? Because the thyroid's doing its job. It's producing the hormones, and people are starting to feel good. And then generally, they just take less and less of their prescription hormone replacement therapy, that's between them and their medical doctor. But they just need less and less and less, and eventually they usually get off of it because their thyroid's doing great. So I'll leave you with that. If you like this video, please subscribe. That will help me grow this channel, and share it with some friends who may be having some thyroid troubles. And I'll see you on another video.